The American healthcare is one of the best in the world, yet in some aspects it is also one of the worst among first world countries. Hello, it's me, Nikita Belausov, and in this short video I'll try and review what I have learned about it so far. First of all, and what's really important to know, is that in the United States, healthcare pretty much equals business. You won't get anything for free, even if you have an emergency. Sure, there are always high-quality doctors to help you, but when you're finally safe and sound, there will be a huge medical bill, possibly of tens of thousands of dollars, that you will possibly have to repay for the rest of your life. Thus, to get their health protected, people have to get a health insurance. Technically, there are two ways of doing so in the United States, either through public or private healthcare coverage. The majority of people use the second option because it's rather hard to get the healthcare that is government-funded. There are two main social insurance programs. First, there is Medicare. That is a federal program established in 1965, aimed specifically at those Americans who are over 65 years old, although it also includes younger people who have a disability. There are several so-called plans within Medicare. Plan A covers hospital stays and nursing homes. Plan B is for various lab tests and medical equipment. Plan C, also known as Medicare Advantage, expands on Plan A, allowing a patient to choose a private hospital to receive healthcare from. And Plan D covers drugs prescribed by a doctor. It's worth mentioning that, on average, Medicare only pays up to half of the patient's expenses, and the rest they have to pay themselves. Considering the enormous costs of everything healthcare related, it can be quite a lot. There is a special Medicare supplemental insurance called Medigap that provides coverage for that difference between the total amount charged and what is covered by Medicare. The second of the United States social insurance programs also starts with a Medi and is called Medicaid. This program is aimed at people with low income who don't have money to pay for their healthcare. Unlike Medicare, it is mentioned by the states instead of the government, so the eligibility and the amount of provided healthcare can differ from one state to another. Poverty is not the only requirement to receive Medicaid coverage, though. Certain age, pregnancy, and individual disabilities are also important. Most of the people who are covered by neither Medicare nor Medicaid have private health insurance via their or their family member workplace. The employer still doesn't pay the full amount, so one has to co-pay most of the prescribed drugs and visits to the doctor. It's a horrifying fact that some 40 million Americans are not insured at all. While some of them are billionaires, others are just average people who trust to luck that they won't get sick. And then when they do get sick, they have no other option but to file for bankruptcy. More than half of all bankruptcy cases in the United States are medical bills related. Now let's sum it all up. On the one hand, America does spend more on healthcare per capita than any other nation. The doctors are highly qualified and get large salaries. The medical equipment is also very good, and the pharmaceutical companies are developing the most advanced drugs. On the other hand, though, the quality of healthcare one gets is directly proportional to the size of one's wallet. While one of the best in the world, American healthcare is also one of the most costly, not only for the people, but also for the country's budget. Something has to be done, and it looks like there will be some changes in the healthcare system pretty soon. We'll see how it all works out, and until then, that should be it for now. Thanks for listening, and goodbye.